I'm not sure why it's not letting me do that, man. I've never had
Hmm.
that problem. It's just like I'll turn mine off then, so it's not awkward. I've seen it anywhere obvious here.
Oh yeah, I wonder if it's if you right click on my name, will it give you a video option maybe?
That's what I'm trying to do, and it won't let me. Oh, there it is. Well said, sir. Oh, dang it. Come on. I'm gonna make you the host. Hopefully that'll allow it to happen. Okay. There you go.
Yeah, we are video enabled. It's the
Okay.
four.
So I think we have to actually start the session somehow. It should be on your side to start the webinar and introduce ourselves and put it on slide one there if you want. Does it say
Okay.
start webinar at the top?
Start webinar. Yes. Let's get started. Start.
And I've turned it on the record.
All right. And I'll go into presentation mode.
Lovely. Mike, thanks for joining us. We've got a handful of participants joining the meeting room as we speak. We're going to give, it is now 12:02, so we'll give them about 30 more seconds till we get started. We're going to try to keep this at 35 to 40 minutes. We've got a lot of hopefully very helpful, informative, and educational information to share. And we'll kick it off here in just a few more seconds. Let the audience get seated properly. We hope everyone is comfortable and enjoying some lunch. Tried to schedule this in the middle of the day so people could take a break from their normal activities, join us, and hopefully at the end have some opportunities to have some actual dialogue and some good questions. With that in mind, we'll get started. I am Bryan Mitchell. I lead marketing here at Sonicu, based out of suburban Indianapolis, Indiana. We are a temperature and environmental monitoring organization that specializes in healthcare life science organizations, helping them solve some pretty complex problems. With me is Mike Hanna. Mike, would you introduce yourself and TrueSpot, please?
Yep, absolutely. Thanks, Brian. Yeah, excited to be here. Excited for the partnership with Sonic. Again, I'm Mike Hanna. I'm the founder and CEO of TrueSpot. We are a pioneer in real-time location services. We were founded in 2016. A background in telecom, wireless, high-tech communications. Myself and a lot of the founding members of the team. So we are radio experts, and we built quite a different system when it comes to real-time location systems with our AccuFind platform. And so super excited. We've been working with hospitals and healthcare for the last couple of years, working through asset management, real-time location, and how we bring the power of that to the healthcare industry. So at a really quick high level, one of the things that's brought Sonicu and TrueSpot together is the opportunity to really impact the healthcare industry and a lot of synergies within our solutions. At a super high level, just to kind of kick off, there's tens and tens of billions of dollars that are wasted each year through inefficiency, healthcare and hospital operations. A lot of that is to do with asset management, real-time location systems, and the capability to drive better operations there. And then also obviously with environmental temperature monitoring and a lot of the things that Sonic are doing. There's not only financial impacts, but there's also tremendous impacts to patient care, as well as employee satisfaction, customer satisfaction due to these issues. So from our perspective, TrueSpots and Sonic as well, that's our mission and purpose, is to solve these things for the healthcare industry. Real quick on the agenda, and then I'll hand it back to Brian. So we'll start with Sonic giving an overview, the problem statement of exactly what they're addressing. Then an introduction to Sonic talk through their solution. Then we'll do the same for TrueSpot when it comes to asset management, real-time location systems, and then how we uniquely address that. We'll also talk through the synergies of both Sonic and TrueSpot from a solution and a technology perspective. And then we'll wrap up from there.
Excellent. Thanks so much,
Brian.
Mike. Real quickly, this is being recorded and we will share the recording with all of the participants. I'm going to move fairly rapidly through these next 7 or 8 slides because they're really a high level before we get into the really meat and potatoes of our technology, why it's unique and why it's uniquely positioned to help people like yourselves. Uh, but in terms of what we do, big picture is we automate what have been largely manual processes, and by doing so, reduce risk around losing assets to a temperature excursion. We reduce risk around being dinged on a regulatory audit, and we decrease the amount of labor required to both safeguard your assets and complete those regulatory reports. So we solve three big problems for our clients. We're going to get a little deeper into that through these slides. Next slide, please. Excellent. So the three problems we solve, right? Safeguarding assets. It seems about once a quarter, we see one of these just extraordinarily sad, if not heartbreaking stories of organizations losing, whether it be drugs, plasma, tissue, blood, research, food, due to a very preventable temperature excursion. So for a very small cost and a very simple installation period, we could put sensors inside of fridges and freezers and help you prevent these kind of headlines that have plagued some very reputable organizations that you would thought would have had this kind of technology to prevent these kind of losses. Next slide, please. The regulatory environment is pretty intense right now. There are no shortages of opportunities to go onto the FDA's website and other organizations and look at the raft of violations that, whether it's the FDA, Joint Commission, CDC, Board of Pharmacy, right? And then on the other side of that, there's the very real issue of drug shortages that when we talk to our pharmacy clients tell us are more acute than ever. So you can imagine if you have a shortage of drugs, the importance of protecting those drugs becomes even more vital. So a lot of our clients look to us both to automate the regulatory environment to stay on the right side of the FDA and to not end up on the news like you see there on the right, where patients facing oftentimes life-threatening illnesses don't have the drugs they need due to shortages. Next slide, please. Labor. The slide on the right, I had to look at twice. That does not show a decrease in labor costs in healthcare. It simply shows a lessening or a decrease of the rise of the cost of labor in healthcare. So from 2002 until last year, those are all the percentages of which healthcare has increased, the labor in healthcare. And then on the left, the percentage of which hospitals spend their budget on labor. And like most organizations, it is the majority. So when people look to Sonicu, yes, they look to safeguard their assets. Yes, they look to lessen their regulatory burden, but they also look at charts like this and say, we're spending a fortune on people, and some of those people are doing very rote activities that can be automated through a monitoring system. Next slide, please. Who we are at Sonicu. So people come to us across all sorts of sectors, mainly healthcare and life sciences, a little bit of food service, and a healthy dose of government clients as well. They come to us because they've suffered one of those three problems, right? They've got too many staff spending too much time logging their temperatures or logging environmental conditions. They've lost assets, or they've gotten dinged on a regulatory audit. So a lot of these clients come to us after suffering those problems. We work with them, build a consultative process, and help them implement a solution that stays ahead of those problems and ultimately saves them time and money. Next slide, please. Okay, Mike, over to you in TrueSpot.
Yeah, fantastic. Thanks, Brian. Yeah, so TrueSpot, a little bit more from an introduction perspective. I mentioned we were founded in 2016. The team, a lot of the DNA comes directly out of telecom, high tech, and wireless, and that is what has given, I believe, TrueSpot a really head start and kind of an innovative edge when it comes to the technology and the real-time location system that we call AccuFind. We're tracking at this point over 100,000 assets across, closing in on, I believe, 500 campuses across the U.S. and Canada. We are cloud scale. We're also a Microsoft certified solution and a Microsoft co-sell partner. And we have multiple patents that have been granted on this, the technology, and several more pending. So a little bit like what Brian said, the problems from our perspective as we look at hospitals and healthcare, one of the key ones is delayed patient care. So if you can't find a piece of equipment that you need or what you're looking for to help work with that patient, then delayed patient care is a big one. Increased cost due to lost assets. We see quite a bit of lost assets leaving either the hospital or just getting lost through the mix of the daily shuffle. Lost revenue, so ability to turn patient beds faster. We see direct impact of our system and services to do that. Also, underutilization of assets. And so a lot of times, in many cases, there's more from a par level assets that are actually acquired and maintained by the hospital. But if you had a system to be able to track and manage those assets more efficiently, there'd be, I think, very distinct savings and utilization of assets, and then compliance issues. And so finding those assets, making sure preventative maintenance is done and those sort of things. A lot of times you can't find them. They're in a desk drawer. They get put back into service and it's out of compliance. So those are really big regulatory issues, similar to what Brian mentioned as well, that real-time location systems can directly address. So from our perspective, when we look at real-time location systems across the healthcare space, we believe that 90% of hospitals have not implemented a real-time location system as of yet, even though the impacts and the ROI and the value are excessive when it comes to the asset management and real-time location. And the reasons why are it's just a historical super high cost to deploy and maintain those systems, made even with the best opportunities for ROI, made it really hard to justify budget. Also, there's a history of just unreliable technology, even still today. So there's a legacy of kind of a bad taste and a lot of hospitals from those systems not living up to expectations, being high cost, and not being able to do what they were meant to do. Complexity of use. So a lot of the systems have aged and rely on an older technology, archaic user interface. So there's just a lot of complexity in how you utilize those systems to actually get done what you need to get done. And then ultimately, a lack of performance. All those things coming together, the system is just not working, not doing what it's supposed to do. With that in mind, that's why we invented MedSpot 360. MedSpot 360 is our asset management and real-time location system and services for hospitals. MedSpot 360 is powered by AccuFind. This is the real-time location system platform that TrueSpot has been developing effectively since 2016, 2017, with multiple patents and very unique. Nothing else like it from a technology perspective in the market, and we'll talk a little bit about that in a second. But it makes it super easy to install, absolutely plug and play. We track indoors, we track outdoors, we track in parking lots, we track in parking garages. The technology allows us to do that very seamlessly at a plug and play level. Moving into not just location, but what location can do for operations. Very strong, powerful reporting, using location insights to drive different kinds of awareness, different kinds of analytics, and things like that that go well beyond par levels or where an asset is at when I need it. Something that we are very serious about from that perspective. And then just usability. Any application, web browser, iOS, Android, very easy to access on any device, anywhere, anytime from a TrueSpot perspective. Really quickly, the true tags, we call them. So how do we track things? Well, we add a little piece of hardware, a little radio tracker to every asset. We have multiple different kinds and form factors, different kinds of IP ratings. Some are IP67, go through high pressure wash, high heat, that sort of thing. Some are stickers, literal stickers that are super small, smallest in the industry, that allow you to quickly attach. And some of those devices that you really need low profiles, these stickers easily attach. All that being said, super long battery life and super cost effective for all of the tag family, the TrueTag family from TrueSpot, for any use case, for any asset to tag and track. Quickly, how we do it effectively, I view it like a cellular network. And so we come a lot out of the cellular space. And so very much like that honeycomb or cellular-based system, we deploy a series of gateways throughout the hospital, multiple floors, indoor, outdoor, doesn't matter. Because of the technology, because of the low power radio network that we employ, we can plug and play these gateways and exactly to what the hospital needs from an operational perspective. So room level accuracy, even tighter for wash areas, those sort of things. If that's needed, we can quickly do that, tune the network to deliver that sort of location fidelity, and then build the geofences, the geozones, whether the floor-based, whether the department-based, all of these things that then start to drive analytics, real-time visibility to par levels, and all the things that go beyond just finding an asset when you need it, which we do that better than any other company in the industry. But taking that and actually applying that intelligence in that location is critically important with the MedSpot 360 system. And then the gateways are plug and play. So as I mentioned, there's a couple pictures here quickly. One is plugging into a router. We're not actually using anything from a Wi-Fi perspective, so no connectivity at the campus is used. But the power source can be anything. Can be a TV, can be a Wi-Fi router, can be another piece of electronics, or we can plug into walls easily as well. So super simple there in the setup and the delivery of the network. Now to the fun stuff. So I'm a technology guy. Some of the key differentiating points, both for TrueSpot and Sonicu, which is why our partnership is so interesting and I think very beneficial from a hospital healthcare perspective. So we operate on a low power radio network technology called LoRa. So we're in effect private network operators. We manage, maintain, operate that network in a way just like a Verizon or an AT&T would. So we have a full network operations center, managing, monitoring. And what that network allows us to do in that technology is create a complete campus coverage. So it's super low power, operates at 900 megahertz, which is low band, so super great propagation throughout the entire campus. Again, indoor, outdoor, penetration through walls, cement, all that sort of stuff. And then with that connectivity, we are not relying on Wi-Fi. Sonicu is not relying on Wi-Fi. That network has better propagation, better proliferation throughout the campus, and we're connecting everything to it. So from TrueSpot's perspective, it's our real-time location system, our plug-and-play gateways, and from Sonicu, it's their environmental monitoring, temperature sensors, and the like. With that, it's significantly advantaged over Wi-Fi and cellular from cost, from battery, from performance, you name it, it works better. And so that's why we built our foundation and Sonicu as well on the LoRa capabilities to deliver that at a healthcare campus and beyond. Really quick, I know this is kind of a technical busy slide, so I'll just talk to it really quickly. From left to right is just kind of how the systems work. And so if you think about it from both Sonicu and TrueSpot, we're tracking assets. Sonicu is monitoring all of those assets in real time. Sometimes you're actually doing both in the same set of assets. You want to know the location and you want to know how the temperature, humidity, and those sort of things are with that. So another point of synergy between both Sonicu and TrueSpot. That being said, we deploy those gateways, which are LoRa and Bluetooth Low Energy based. And then that LoRa network backhauls all of that data back to our respective clouds. So from a Sonicu perspective, all the environmental monitoring, temperature sensor data, et cetera. From TrueSpot, all the real-time location, all the asset movement, all of those things that go with that now being pumped into our clouds and then being utilized obviously by the users through the systems and the services therein. Really quick, just a couple quick visuals for TrueSpot. So from any device, tablet, web-based, browser-based, native applications for both iOS and Android, easily accessible and built to manage and tackle almost any use case from a hospital asset management, real-time location perspective. One other quick detail, just to go into another feature benefit of TrueSpot is what we call our MODAR mode. We like to make up words. This is kind of a combined word of mobile and radar. But effectively, what this allows you to do through any mobile device is find any asset, no matter how hidden it is. And so if infuser gets put into a drawer, papers get put on top of it, and you need to find it, we're going to be able to find it very quickly with MODAR mode, which transitions to a proximity sensor from the cloud-based, network-based location in real time, making it super easy within seconds to find any device anywhere, even if it's hidden in a ceiling tile, which I've seen and heard examples of that. And with that, I'll turn it back to Bryan for a little bit more on Sonicu.
Yeah, thank you so much, Mike. That's a tremendous, tremendous opening. And really what I want to stress and reiterate is the power of that LoRaWAN network, right? So what you see there in the center of this presentation, that SonaLink hub, is our version of LoRaWAN, right? And what we were able to do there is remove the need for an IT assessment or for any type of involvement with your private network at your healthcare facility, or they'll worry about putting on cellular and any of the interruptions that cellular networks can have. And as Mike spoke about, that LoRaWAN network was developed specifically for these type of use cases, to go long distances, to consume low amounts of battery, to go through steel and brick and glass and all of these things in order to transmit mission critical data. In this case, the temperature inside of a fridge holding life-saving cancer drugs, tissue, blood, plasma. We've also got some key features on that communicating duo radio. I won't get too deep into. We'll save that for when you get a proper demonstration from our sales team. But needless to say, when we're protecting the drugs, blood, tissue, life-saving research, there is a tremendous amount of redundancy built into our system to make sure if there is an issue, you are alerted and can respond in the appropriate amount of time. Next slide, please. Again, the problems we solve, right? So this is very important when you think about Sonicu, because most of our customers just come to us with one or two of these problems, and only upon digging in deeper to their current administrative system do they fully recognize all of the savings and all of the opportunity to improve the way they do business that can be realized with a system like Sonicu. So we're right there in the sweet spot of helping you automate your compliance, protect your assets, and have your people doing less of the manual activities that, as we know, are expensive, cumbersome, and prone to human frailty, mistakes, and just forgetfulness. Next slide, please. So again, just a simple how it works. Think about your typical healthcare environment. You could have one router, one LoRaWAN router, talking to all of these different devices, right? A temperature monitoring, whether it be a vaccine or drugs in one room, the ambient conditions in a laboratory or in a isolation room, understanding where your defibrillator is when it maybe got legs to go help a patient, understanding a patient fridge condition, and even a water leak inside of a restroom on one hub. So I hope that helps illustrate all of the different applications. We'll dig deeper in a couple more slides. Next slide, please. Again, the software on our side is what really is exciting about what we do. And we say exciting because it is a constant work in process. We've got a full team of US-based software developers that are working literally around the clock in order to improve this software. What you're seeing here is a couple of the key screenshots from the software. People love the way we work with them to develop a floor plan of their location. And so you can see there in exactly which room and exactly which part of the room where you've got the red dot where you've got the fridge that's having issues. So you can imagine when you're trying to respond to an alert, knowing exactly where to go and how powerful that can be. Next slide, please. Just high level, the amount of things that we can monitor. On the regulatory side, you're looking at all of our products that have the NIST certification, right? NIST being the government agency that essentially validates the accuracy of these and is pretty critical to any sort of FDA, CDC, Joint Commission sort of auditing process. So from high heat down to ULT and cryo, ambient conditions, differential room pressure, we've got this tremendous breadth and depth of product to solve the automation of that regulatory burden. Next slide, please. And then we're really excited about what we do on the non-regulatory, what we call facility monitoring side, that again, all can connect real simply to this LoRaWAN network. So we can count people in your facility, tell you what rooms are being used, set up a water leak detection system, whether it be in a server room, under an ice machine, in a restroom, to tell you when you've got a water leak, and then indoor air quality, CO2. And a lot of our clients have gone to applying open door monitoring, which is a super simple installation. So when they get an alert about a fridge being out of spec, they can say, okay, do we have an open door alert, in which it's a very simple response, or do we have a fridge out of spec, which the door is closed? And you can imagine a response to that being very different. Next slide, please. Beautiful. Mike, I believe this is yours.
Now, fantastic. So we showed a little bit before the network diagram, and just one other additional point here that I mentioned is that we can also track outdoors. So with the LoRaWAN network that Bryan and I are talking about, great propagation coverage outdoors. So wheelchairs are leaving, they're in a parking garage. It doesn't matter. So through battery and or solar, we can easily add gateways outdoors. Really comes in handy in trash, dumpsters, and receptacles and things like that, where assets, telemetry bricks, these sort of things get rolled up in sheets and go out all day long. So not only that, we can also detect these from a proximity perspective. So egress points, exit points, actually a real-time alert going off, just like a mall center sort of thing when you're leaving the department store. If the tag wasn't taken off, same thing applies, but then also digitally and also tracking it to wherever it goes. If it goes out into a dumpster that happens to be away from the building, we can track in those areas as well. One other quick thing to mention, I think this is critically important. So both Bryan and I talked a lot about LoRa, the technology and the capability. We also invest heavily in the monitoring and management of our LoRa networks. And so full network operations center, we come out of the telecom space. So we looked at it very much from that regards, reliability, capability, throughput, every device, every piece of data that's happening on those devices that are in our networks. We're monitoring in real time for anomalies, exceptions, and any issues. And if anything comes up, typically we know about it before the customer does. So one quick point on the network operations center, critically important because these networks are carrying critically important data. One other quick thing I think is really interesting is just the powerful capabilities when it comes to reporting and analytics. So a lot of things with the data, and we're just at the beginning of this from an industry perspective, I believe, but those large location data models and how that gets applied to hospital operations. And so we spend a lot of time working with hospitals and understanding operations so that we can apply location to those things. And then create much better insights and analytics and capabilities beyond just, hey, where things are at, par levels, those sort of things. So a quick example could be asset utilization. And so based on the location of the asset and obviously tracking that asset all the time in real time, and you start to look at that from a trend perspective. If it's in a storage room, storage closet, for example, that asset is obviously not being utilized. If it's inside a patient room, we can make the assumption it is. And so you can look at those things over time and start to really get more powerful data than what you've had before for any asset, anytime, anywhere. Lots of other examples as it relates to that. But we're super excited about the operational, and that as that transitions to more AI and these sort of things, these large models that will drive that. Super interesting, super powerful for hospitals.
Thank you, Mike. Very high level. Our software as well is the backbone. I showed a couple of screenshots earlier, but again, these are the key elements for why people invest in Sonicu. The hardware is a means to an end. It's reliable. It is proven. It is tested. It is NIST certified. But ultimately, the software is what you will be interacting with. You can see the different kind of key screenshots, and I'll talk a little bit about each. The one on the far left on your phone is the most obvious. Pharmacy cooler temp and alarm activity. We send dozens of these every single month. You can imagine how important they are to our clients when they get an alert like this. What's interesting is we also have alerts for power outages. I did a case study with a retail pharmacy based out of Ohio with nearly 80 locations. And they shared with us that one of the things they really loved is they don't just get alerts when the temperature goes out, but they get alerts when the power goes out, which you can imagine can be a equally troubling situation because you're going to have cooling go out right behind it, not just for your drugs, but also for your ice cream and deli meats and all the things that are in their location. So there's a lot to Sonicu that we're not going to cover here that I invite you to do a full demo and truly appreciate the power that our system delivers for our clients. Next slide, please. So high level, what's also, I think, exceptionally powerful about our system is we are not just able to provide you data on your cold and frozen environment or your isolation room or compounding pharmacy, but you can work with us and our customer success team and actually dig into the hardware and software and do quality checks on how everything is working remotely, right? And this is a big part of the value of Sonicu is you're not just getting a remote monitoring system, you're getting access to a full team who's got a decade of experience of helping people like you solve these problems, right? And they'll teach you how to use both the mobile app and the desktop version to self-diagnose or diagnose with the help of our team so you can truly have peace of mind that not only do you have a monitoring system, but you have one that's working like it's supposed to and do that diagnosis. So the software is incredibly robust, a ton of features, again, more than we want to go into in the 35, 40 minutes here. In a full demo, we can show you this stuff, but I promise you, it is robust and really built around redundancy and giving our customers peace of mind that the system they invest in and are relying on is working as advertised. Next slide, please. And then finally, right, just the meat and potatoes of the system. People love to log in from their phone or from a desktop or from a laptop and just see, okay, what's going on? Do I have some alarms? Again, one of our product specialists can show you, but in the app, you can open up those threshold alarms and respond to it. You can put notes in there. You can pause it. You can send the alert to somebody else. I mean, it is an incredibly robust system, especially from the mobile app, which I think our customers, well, take that back. I know from all the case studies we've done, our customers love it, right? Because at nights and weekends, they can open that app and have that great peace of mind that if something happens, they can respond appropriately. Next slide, please. And then finally, like Mike said, in the past, there was, I think, a certain degree of justified apprehension, bordering on anxiety around the process to onboard, install, configure, train a team around a real-time location services system. I think the same could be said for a temperature and environmental monitoring system. But I can tell you that we've done hundreds and hundreds and hundreds of installations from simple retail pharmacies with a handful of fridges to incredibly complex enterprise healthcare systems with operating rooms, isolation rooms, compounding pharmacies, multiple fridges and freezers in different parts of the hospital. We've got a proven, time-tested, battle-proven method to deploy, train your team, and provide the ongoing support to ensure you get that return on investment. So we'd love to walk you through this again in a more thorough call, but just wanted to share that we're not winging it when it comes to installation. We've got a very thoughtful, methodical process that we will walk you through and give your team peace of mind that you're going to get a system that delivers as advertised. Next slide, please. Mike, back to you, sir.
Yeah, thanks, Brian. That was great, and I think from our discussion, you can see a lot of the synergies, both in kind of personality and innovation background, but specifically in technology between Sonicu and TrueSpot. So the synergies there are quite a few, and from a complementary approach to how we connect devices. Just start there. We're not worrying about Wi-Fi. We're not worrying about any of the campus connectivity. We're being able to manage and operate this on a secure, private wireless network that's purpose-built for the exact cause. And even with that being said, if Wi-Fi is not an issue, it's not built for real-time location. It's not built for connectivity of IoT-based assets. And so it's a misfit from a purpose perspective, which causes problems, from a connectivity, from a battery power, other things that we solve with the technology. So common vision from Sonicu and TrueSpot from a technology capability perspective. And then empowering hospital personnel. So, one of the things that Brian talked about, a lot about labor. I didn't mention it as much from a TrueSpot perspective, but critically important. And you look at the time spent looking for assets, and that time better spent managing, working with patients and taking care of more critical tasks. So those are the things from Sonicu and TrueSpot that really we're focused on, because that time is critical, and in a hospital healthcare environment, even more critical in many cases than what it would be otherwise. And so super important, and one of the key things that we both aim to deliver. Really quick at a high level between both systems, and Brian chime in on a couple of these things, a lot that we've talked about already, about a common core and technology, and then additional integration opportunities to come. So there's a lot of power just in integration of systems and different things. So we're just getting started between Sonicu and TrueSpot. So we love operational feedback and those sort of things as we continue to look for ways to bring synergies together with the market. Best in class systems, and so these are from a pioneer perspective. These are the latest and greatest from a technology capability perspective. Infrastructure completely scalable, cloud-based. Easy plug and play deployment of systems, those things that we've talked about, make it super easy to onboard. Bryan talked through the Sonicu process for onboarding, very similar from a TrueSpot perspective. Methodical, we've done this many times. We know how to get a system up and running very quickly and then operationalize that, training for the teams, then ongoing support, customer success, and the like. Also critically important is low cost. And so one of the key inhibitors from adoption of these systems in the past has just been the cost to get it going. And so because from a TrueSpot perspective, completely different technology, and speaking for Sonicu as well, I believe the same, we are able to do this from a cost pioneering perspective as well. So not only is the price the most, I would say lowest, just point out in the industry, but you're not sacrificing performance or capabilities. You're actually gaining in those capabilities from both the systems from TrueSpot and Sonicu because of the technology and the implementation of the systems. So easy from an IT perspective, kind of last but not least, IT departments love us as we go through security, we go through the IT provisioning, understanding. It ends up being a very lovable relationship between the TrueSpot AccuFind network and then the IT teams. And with that, I'll turn it back to Bryan, but just want to say thanks for all the attendees, and then also thanks to Bryan and Sonicu for the partnership, and we're looking forward to many more things to come.
Yeah, thank you, Mike. I would reiterate everything you said. I just want to stress the major point as we close today's session is, most of us are, if you're like me at least, you haven't had much introduction to this LoRaWAN sort of technology. You're familiar with Wi-Fi, you're familiar with cellular, of course, maybe a little bit with some of these other communicating protocols. But the big takeaway from this session is the idea that there's this one hub that solves so many problems inside of a healthcare environment in terms of IT security, in terms of cost, in terms of penetrating walls, in terms of connectivity, ease of installation, everything Mike talked about there, all powered by this one hub. And it's a different way of thinking about connectivity. So I hope you take that away as we open it up for any questions. I think we have one here for Mike. Well, let's see here. Mike, there's a... Okay, will we be sending out the slides?
Yes. Oh, you're asking me? Yes,
Yeah.
we can absolutely send out the slides.
And we'll do you one better. We'll send the slides and we will send the video recording so you can share. And we ask that you share liberally. Obviously, a lot of work went into this where Mike and I trying to prepare to give you the best possible story. Another question, Mike, how long does the average deployment take for the TrueSpot system?
It's a great question. A little bit of it depends on the size of the facility, how many floors, how many beds, that sort of thing. I can give a quick example just for reference. So 8-story, 250 bed hospital. The system, the RTLS network, we could have stood up within a couple days, functioning, performing. What's going to take a little bit longer is the tagging of the assets, and so those assets are always out in space, and so just working with biomed and supply chain and how we do that takes a little bit longer. We typically spend a few days helping, and that's part of the training, part of the operationalization. I think I got that word right. Too many syllables for Tuesday, but that takes a little bit longer. So from our client success or customer success perspective, we'll continue working with that. But a lot of train the team kind of happens after that first day or couple days of getting the network up and running, and then ongoing kind of tuning, optimization, maintenance, and then with the system itself, different users have different capabilities within the system. So sometimes somebody wants to use the dashboard, looking at par levels per floor, per department, these sort of things. So training ongoing, fairly easy, very intuitive system to use, but then we're always with the customer from that point forward. But short answer, a couple days to get the system up operational. And then we want to load the system as much as we can with tagged assets. And so we'll spend some time helping Biomed and the teams do that as well.
Yeah,
Hope
on the
that helps.
Sonicu side. Yeah, thank you, Mike. On the Sonicu side, I know the question was for TrueSpot, but on the Sonicu side, it really depends on the complexity of the installation. We have some fairly unique solutions in like the operating room, right, with a room pressure monitoring and an in-room display that require a bit more sensitivity and thoughtfulness around installation, working with a facility team. But on the temperature side, right, to put a probe inside of a fridge or freezer, we can, do that ourselves or train many of our customers to do that in, 20, 30 minutes after you've done one or two of them and are up and running. I've done many case studies talking to pharmacy techs and nursing assistants and physician's assistants who've said, yeah, after I did one or two, I was getting them installed in 20, 30 minutes each and using the mobile app to configure them. So however many fridges and freezers you have, just multiply that by maybe 30, 40 minutes if you want to be really liberal. We have a done for you installation by a Sonicu team, or we can train people to do it themselves. So it'll really depend on the number of fridges and freezers you have, and if we're going into any of those more sensitive environments, that's going to require a little more coordination with your facility team. And the same thing as Mike said so well, there's going to be that ongoing training and making sure the team on the client side is familiar, because ultimately one thing we stress at Sonicu, and it's another important point to convey in this webinar, is this is not a system that is just installed and then kind of runs itself, right? Someone on the client side needs to take ownership of the system and be able to both drive the training, own the training, keep an eye on the system, work with Sonicu to make sure everything's connecting and working appropriately to get the value out of the system. This is not something we just come in and install and you forget about. Someone needs to take ownership and be a champion internally at each of our clients to ensure that ROI, because ultimately they're your drugs, they're your tissue, it's your research, right? And someone needs to take ownership of that. So there's always the ongoing investment to make sure the system's running, but is still infinitesimally small relative to the manual labor that was going on in the past. So hopefully that helps in terms of time to get a project up and running. But in a typical hospital, it sounds like if a client installed both TrueSpot and Sonicu, we're talking about a couple of days of installation and a couple more days of that ongoing training and making sure everyone's comfortable. So this is not a months-long process. You could have both of these systems up and running and getting that ROI in about, 2 business weeks worth of time, being very liberal about the interpretation of such. Would you agree with that, Mike?
Yeah, absolutely. And it goes back to one of the core benefits of having our own campus-based private wireless radio network to do that. So we're not, again, worrying about Wi-Fi, where it's deployed. You have to upgrade the Wi-Fi system, connectivity issues, all the things that go with that. So part of our advantages, both Sonicu and TrueSpot, is our ability to just plug and play and deploy that based on operational needs, regardless of where those things are happening on campus. So.
Love it. Last question, where will the recording be available? I will put it on our YouTube channel. I'll give Mike a copy as well to put on their YouTube or whatever resource they use to share, and then I will share that link. It'll be a public link, so it'll be widely available, and we will share via email, and you can come to our websites as well. We've got a landing page on our homepage that walks through a lot of this content, and again, we invite you to book a meeting with one of our sales team. There's many more layers of detail and value to learn about both products, but we want to keep this brief. And we've almost succeeded, Mike. We're 41 minutes in. I think we did pretty good. Our goal was 35, but obviously Mike and I are excited about our products, so we'd like to be verbose and guilty as charged. So thank you everyone for attending and for taking your lunchtime, for being with us. We'll send the recordings out, and we really look forward to continue the conversation with you one-on-one.
Awesome. Thank you, guys.
Beautiful. So you ended the session?